The familiar anxiety surrounding COVID-19 has resurfaced across India. Recent data from the Union Ministry of Health shows a noticeable upswing in cases. This development in late May 2025 has caught the attention of health officials and the public. After a period of calm, the numbers tell a story of a renewed challenge. The situation demands careful observation and a proactive public health response. It is crucial to understand the scale of this resurgence. The data points towards a trend that cannot be ignored by citizens or authorities. As of May 31, 2025, the country recorded a significant rise in active COVID-19 cases. Active cases surged to 3,395, with 685 new infections in the last 24 hours. This rapid escalation suggests efficient virus spread and raises questions about new variants. Immediate and thorough investigation is needed to curb further spread. The current trend serves as a stark reminder that the threat of COVID-19 has not been entirely extinguished. The resurgence of COVID-19 is not uniform across India. Certain states are bearing a greater burden of the current caseload. Kerala, for instance, remains the most affected state. It currently reports 1,336 active cases. This accounts for over a third of the country's total active infections. The situation in Kerala highlights the regional variations in the pandemic's impact. This concentration of cases necessitates targeted interventions and support for the state's health infrastructure. Continuous monitoring in Kerala is essential to understand the drivers of this sustained high caseload and to prevent it from overwhelming local healthcare systems. Following Kerala, Maharashtra is also experiencing a significant number of active cases. The state reports 467 active infections. Delhi, the national capital, is another area of concern with 375 active cases. Notably, Delhi recorded the highest daily spike recently, with 81 new active cases reported in a single day. This sudden increase in Delhi is a cause for worry, given its high population density and its role as a major travel hub. The rising numbers in these populous and economically important regions require swift action from local administrations to ramp up testing, tracing, and healthcare preparedness to manage the increasing patient load. Several other states are also witnessing a steady increase in COVID-19 cases. Gujarat currently has 265 active cases. Karnataka reports 234 active infections. West Bengal is dealing with 205 active cases. Tamil Nadu has 185 active cases, and Uttar Pradesh reports 117. Even states with smaller numbers, such as Rajasthan with 60 active cases and Puducherry with 41, are seeing upward trends. This widespread, albeit varied increase, suggests that the factors driving the surge are not isolated to one or two regions. It points to a broader national trend that requires a coordinated response to prevent further escalation. The human cost of this resurgence is also becoming apparent. In the 24 hours leading up to May 31, 2025, 4 deaths due to COVID-19 complications were reported. These unfortunate events occurred in Delhi, Kerala, Karnataka, and Uttar Pradesh, involving men. The patient in Delhi was a 71-year-old man who was also suffering from pneumonia, septic shock, and acute kidney injury. These comorbidities often exacerbate the severity of COVID-19. So far in 2025, India has reported a total of 26 deaths attributed to the virus. Each death is a reminder of the potential severity of the illness, especially for vulnerable populations. The rise in COVID-19 cases is linked to new Omicron subvariants like LF.7, XFG, JN.1, and NB.1.8. Scientists are studying their transmissibility and severity. WHO has categorized them as variants under monitoring. India is enhancing surveillance and preparedness. Delhi issued an advisory to ensure medical supplies and equipment. Amidst rising cases, health authorities advise no immediate need for panic. Most patients exhibit mild symptoms and are treated at home. Recovery rates remain high, with 265 people discharged recently. Dr. Rajiv Bail assures that vigilance is necessary, but there's no reason to worry. Vaccines remain effective against new subvariants. Continuous monitoring and public adherence to precautions are crucial.